This is Mood, Menopause, and Mojo. Two docs, real talk, sparks included, because the rest of your life deserves fireworks too.
So what does it mean when you feel disconnected from yourself and you just don't feel like yourself anymore?
So, this is one of the things that I hear a lot in my practice. So, I am geared towards treating perimenopause. So, I get a lot of women that show up because they've seen a lot of other people because things just don't seem like they're going well and nobody has a real answer for them. So, a lot of times, what I'm tuned into is hormones. So, how are your hormones changing? And what about what's going on in your life is being impacted by that, or is that impacting more of? So, a lot of times, what we're looking at is people don't feel like themselves in the standpoint they feel more angry or they feel more moody. They feel so tired, more tired than they've ever felt
Mhm,
before. They feel like they change all the time. Like I'm this way one second and then I'm this way the next second. And these are people that are not used to feeling this way. Things don't feel as clear in their head. They forget
mhm,
things. They forget names. They forget what they went into a room for or what that guy's name is in the meeting that they're in. It just doesn't feel like things are going the way that they expect them to go. And that can happen in relationships too. But I want to
mhm,
always start from the person that I'm seeing in
mhm,
front of me.
mhm,
And
mhm,
in a
mhm.
middle aged woman, even going into late 30s, early 40s, I'm thinking right away, like, what's going on with hormones? What else could be happening here that isn't just the same old, oh, you're probably just depressed or you're just anxious because your job is so high stress. So a lot of times that's sort of the blow off, and we don't want to do that. So when I see patients that tell me, like, yeah, I just don't feel like myself, I feel disconnected, things don't feel quite right. We do a serious eval for mental health, but also looking at hormones, what's gone on, what's been part of your trajectory in your life with hormones, and could they be playing a part in what's going on so that we can decide, is this something that we want to look at as part of treatment, or is this something that you need more information on, or should we just focus on the mental health piece of it and then see how much improves from there?
It's great. Yeah, I can understand there's a lot of layers as to why somebody doesn't quite
Yeah.
feel like themselves, and it's important to get that assessment as far as biology goes, the hormones. And for me, it's looking at, what does that mean? I don't feel like myself. And a lot of women will say, yeah, I'm just not that same person. Like I am somebody who's like the go-getter, or I'm on top of things, or I can remember things, and now I don't. My body just feels sluggish, or it just doesn't feel like it has that same energy and vibrancy. It's a real hard change. For a lot of them, there's some grief involved. Like the old
Oh, yeah.
me that I don't have anymore. We have to work on grieving that part. There's a real piece of grief in this, but also looking at, okay, then what is this new you looking like? How do we step into the new you? So I will do a full evaluation and assessment. And if I do feel like, yes, oftentimes women may need to go to their OB/GYN or their primary care doctor or psychiatrist to get a look at all of the physiological components if something is off there. But then psychologically and sexually and in relationship, we assess all of that to think what needs to change and shift. And again, what do you want this next chapter to look like? Because you aren't the exact same person. We're constantly growing and evolving. You're not the
Yeah.
same person as you used to be. What kind of person do you want to be now? Or do you want to step into? What do you want that part of your life to look like? And that can help people feel more empowered in creating changes and get out of this funky place of feeling just off and different and into the new version and looking at a lot of things that just may need to change. Because in midlife, I think we evaluate how we're going and often realize some things aren't serving us anymore. And some things really do need to change in our lives. And so I like to help people assess that and make some lasting changes for themselves as they step into this new chapter.
So you said something in there that I want to pull out, and that was when you said empowerment. So I think it's really
Mhm,
important if you
mhm,
aren't feeling quite right, if things don't feel like they felt before and you're not feeling like yourself, I think it is important to find somebody who's willing to listen to you about that and take it
mhm,
seriously and try to see what else is going on. Women often get the brush off like, "Oh yeah, yeah, you'll be
yeah,
fine. Oh yeah, this is just the way it is. You have to get through it." There might be more going on. And you should never feel diminished by that. If you think that
mhm,
things have changed, you should find somebody who wants to listen to you and validate that and then figure out what the next steps for you are going to be.
mhm, absolutely. Very good.
Thanks for hanging out in the messy middle with us. Wherever you are, we'll meet you there. with sparks, stories, and support. Want to meet the docs behind the mojo? Stick around.
I'm Dr. Kristen Zeising, and I'm a clinical psychologist and certified sex therapist. I work with individuals and couples who want to feel more connected, alive, and empowered in their relationships and in their bodies, especially during times of perimenopause and menopause transition.
I'm Dr. B, Jessica Beachkowski, a psychiatrist specialized in women's mental health. There's no one size fits all when it comes to hormones, mood, or libido. But when we stop pathologizing change and start getting curious about what's really going on biologically and emotionally, that's when healing begins. Your mind, your body, and your relationships all deserve attention, especially now. Thanks for watching. For more on psychiatry, sex therapy, and everything in between, visit us online because every woman deserves fireworks.